Nour-Dana Hussein Alibieri. Hello, my name is Nour-Dana Hussein Alibieri, and I'm going to be talking about two of week three's case connections. So the first case I'm going to start with is case three. Hi, my name is Nour. I'm going to be your doctor today, and I'm going to be answering a few of your questions and talking to you a little bit about your diagnosis. So to start, let's talk about your diagnosis. As you know, you have a deficiency of muscle glycogen phosphorylase. This is also known as McArdle disease. This means that your body has an insufficient amount of the enzyme that breaks down glycogen in your muscle tissues into glucose. And so because there's an implication with the release of glucose in your muscles, you may experience feelings of weariness, exercise intolerance, muscle weakening, and it's usually during times of intense physical activity. And so with that being said, I know your first question was if you would still be able to take long walks with your friends. And to answer that, yes, you will absolutely still be able to do this. And this is because walking and other prolonged steady exercises consume more fatty acids to give you the energy to carry out those activities rather than the glycogen that's stored in your muscles. And so this is a great way for you to still stay in shape and maintain your exercise routine rather than carrying out intense physical activity, which we'll get to later. So your second question is if you have to worry about your reduced muscle glycogen stores. And so to answer that, I think there's a few things you just need to be aware of. To start, on a daily basis, when you're exhibiting your normal activities, or even if you're carrying out lower intensity workouts, such as walking or yoga, you don't need to worry about your reduced muscle glycogen stores. And this is because the energy, like I said, is being taken from fatty acids and whatnot. If you, however, choose to carry out a high intensity exercise or activity, this is when you have to be careful as your muscles may feel fatigued or weak. And this is because your stored glycogen is not being broken down during these exercises and activities in order to give you the energy to facilitate them. Alrighty, your next question was that if you had to wake up in the middle of the night to eat to maintain your blood glucose levels. And so no, but yes to something else, and I'll explain. So no, you do not have to wake up in the middle of the night to maintain your blood glucose levels. And this is because your liver plays an extremely vital role of in the it plays an extremely vital role in glycogen metabolism. And so it will keep your blood glucose levels stable, especially considering that you're not going to be physically active overnight and you're not going to be doing anything. So your glucose levels will be normal. However, the times where now I would say you should be monitoring your blood glucose levels would be when you're high intensely working out. So before and after a high intensity activity. And I would say to take precaution, I would say focus on taking in foods that are high in glucose. So these could be sugary foods, foods that are high in carbs. This could be pasta, rice, bread, starchy vegetables, and eating these before and after your high intensity workouts or your activities should hopefully be able to sustain your energy levels during these times. Your last question was if you needed to worry about producing excessive lactate during your intense anaerobic exercise. And no, you are not prone to producing excessive lactate. And this is important because normally during and after anaerobic exercise, the body does produce lactate. And this is important because during high intensity activities, the body can use this lactate as a source of energy. But because lactate is a byproduct of glucose metabolism and your body's glycogen metabolism is interrupted during the start of the glycogenolytic cycle, you are restricted from releasing it. And the buildup of lactate in your body may cause you to experience some of the things that I was mentioning earlier: nausea, vomiting, muscle cramps, and possibly even muscle damage. And so this stresses the importance that you must understand and listen to your body's limits, as well as staying precautious and aware of the intensity of your workouts. Okay, moving on to case 2. So I have a patient who has a tumor in his brain. We did an MRI scan and a PET scan on him using glucose for the PET scan, and we wanted to examine the relationship between the tumor and the glucose that we administered. And so to start, I'm going to be going through some of the tissues in our body and how they normally regulate the uptake of glucose. So starting with the liver. When looking at glucose uptake regulation by the liver, we can see that it's mostly done through insulin and glucagon. And so it does through the use of GLUT2 transporters, which monitor the uptake and release of glucose depending on its availability in the bloodstream. So take, for example, an individual with elevated blood glucose. The mechanism of the liver would work by insulin promoting glycogenesis, which is the conversion of glucose into glycogen, and inhibiting glycogenolysis, which is the breakdown of glycogen into glucose in response to the elevated blood glucose. And so the opposite of this entire process would occur if someone had elevated blood glucose levels. The next tissue we're going to be talking about is the skeletal muscle. Skeletal muscle's main method of regulating glucose uptake is through 2 ways. First being insulin dependent and independent mechanisms, and the second one being muscle movement and activity. And so these 2 methods can activate the insulin sensitive glucose transporter 4, or GLUT4, in the skeletal muscles. And this transporter translocates to the plasma membrane and the T tubules upon like muscle contraction, and it allows glucose uptake through facilitated diffusion. So that's the mechanism through which skeletal muscle uptakes glucose. Now, the brain also plays a role in glucose homeostasis, and numerous glucose sensing neurons in the brain sense small variations in the body's glucose levels, and as a result, they serve as a catalyst for the brain to initiate glucose metabolism. This can be done through initiating glucose uptake in adipose tissue, in skeletal muscle, or even secreting insulin and glucagon from the pancreas, and many other ways. And so these neurons regulate glucose mostly through insulin-independent glucose transporter channels called GLUT1, 2, and 3. This either triggers glucose-excited neurons or glucose-inhibited neurons to attempt to bring the body back to homeostasis. Now, the last tissue we're going to be talking about is adipose tissue. And so adipose tissue is largely regulated by insulin, and it has a very similar mechanism to that of skeletal muscle. When insulin is secreted and glucose levels rise, GLUT4 once again translocates from its internal storage to the cell's surface and plasma membrane by vesicle fusion and transports to, and allows glucose uptake. Okay, now to talk about my patient's PET scan results. So we administered fluorescently labeled D-glucose, and it was largely gathered around the tumor, making it brighter on the scan. You can see that on the right scan. And this then points to the conclusion that tumors tend to show increased glucose uptake compared to the normal surrounding tissues. And the question that comes up with this is, why would this be advantageous to the invasive tumor? So as we know, tumors are known for their rapid growth. And in order for them to carry out this rapid growth or proliferation, it must have a source of energy. And the source of energy we're talking about here is glucose. The metabolism, growth, and development of cancer cells, according to the Wahlberg effect, is all dependent on glucose and the aerobic glycolysis. I'm going to be going a little bit more into Wahlberg effect in a second, but essentially glucose fuels the proliferation of the tumor and cancer cells. Okay, so there's a few possible modifications of cancer cells that may have occurred for this to happen. The first one I want to talk about is that there could have been an overexpression of GLUT transporters. So as we saw when talking about the regular regulation of glucose in the tissues, most all of them use the GLUT transporters. And so this may have allowed for an excess amount of glucose to enter the cell. This in turn feeds the uncontrolled proliferation of cancer cells and tumors. The other one that could have been a possible modification is, as I mentioned before, the Wahlberg effect. And so the preferred use of glycolysis and fermentation rather than oxidative phosphorylation is quite interesting. Oxidative phosphorylation produces more ATP. So it would be the first thought as to what a tumor or cancer cells would use because they need energy to grow and divide very fast. However, it's done with reason that it's glycolysis and fermentation because the glycolysis pathway promotes tumorigenesis, which is the growing of a tumor. So on one end, the overexpression of GLUT is promoting and feeding the proliferation of cells. And then on the other hand, for the Wahlberg effect, the glycolysis pathway is promoting the tumorigenesis. So these are a few ways that glucose may have been taken up by the tumor in order for it to grow and for cancer cells to continue growing and dividing in a rapid pace. And yes, thank you.